I need to tell you about a new treatment that we have in our office that I'm super excited about. It's for an area of women's wellness that is very underserved, which is enhancing the female orgasm. The female orgasm has not been focused on very much at all. There hasn't been much research done on it. There have not been very many options. There hasn't been that much known about it. But we know now that first of all, one of the first things that you should know is that movies are wrong when they show women having an orgasm during intercourse. That does occur, but only about 15% of women are able to have an orgasm with intercourse. It usually requires clitoral stimulation, not just vaginal stimulation. And the clitoris does have a lot more nerve endings than the penis, that women are able to have multiple orgasms. But it can be very difficult. It can take a long time. As we get older, they may not be as intense and pleasurable. So it kind of begins to snowball from there because it's not as satisfying. You're tired, for one thing. You're working either out of the home or in the home, taking care of kids, taking care of your husband. At the end of the day, if it's not that pleasurable, it's just not worth the trouble a lot of the time. So the idea here is to build back up the pleasure center of the clitoris, make it easier for women to have an orgasm, and quicker and more intense. And so we do have platelet-rich plasma that can be injected into the clitoris, and I actually have a technique that I do that is pain-free, but a non-invasive technique is going to be even better, and we have that now. There's a new treatment called Cliovana, and I'm one of the first doctors in the nation that has this treatment, and it's really incredible, and we're getting our first results back from my own patients, and it's very favorable. They're noticing a big difference. So what it is low intensity sound wave treatments that are geared onto the clitoris. And the clitoris is not just the little glands that we think of, but it also has crus, which are little legs that come down from it. So it's like a wishbone shape. And the Cliovana treats the whole thing. It's a combination of pulling the blood into the clitoris, treating with the sound waves, and then a soothing treatment at the end that has sound waves and a vibration component to it. And it's very easy. It only takes 10 or 15 minutes. There's no pain involved. It's just kind of a weird tapping feeling. You go on about your day, come in twice a week for 2 weeks. It's a total of 4 treatments. That's the protocol. And then some people notice a difference right away, and especially the day of the treatment, you might notice a big difference. But it really takes 3 months to build it up, because what it's doing is the sound waves are causing a little bit of micro trauma to the blood vessels and the structure of the clitoris. It stimulates the growth cells, the growth factors, builds up blood supply, nerve endings, makes everything more sensitive and more responsive. So the initial studies are showing just unbelievable 90% success rate of patients that are very satisfied. They notice a huge difference with the Cliovana treatment. And I'm just so excited because there's now something out there for us that it's just been so limited on what the options are. So anyway, I'm really excited about it, and I think it's a great treatment. There's really no downside to trying it. So if you're in the Houston area and want to come in for a consultation, please call us. I'd love to We'd love to talk to you and see you and see if you're interested, and get you signed up, because, you know, women have been kind of overlooked in this area. There's a lot of focus on men on erectile dysfunction and Viagra and all that kind of stuff, but for women, it's not as much. The other thing that we're doing is the bioidentical testosterone pellets, and that combined with the Cliovana is a powerful combination, because the testosterone will improve your libido and just your overall sense of well-being, feeling good about life, feeling more energy to be able to accomplish everything that you're doing. And it's very safe. We're not going to man levels. We're not going to beard levels. We're going to 20-year-old you levels, which is, you know, when you feel really great when you're 20 years old. So that's another thing that we can do to really help boost that. The last thing, that this is really new, it just came out last week, is a new medication called vyleesi, which you take right before you're going to have sex, and it works on the dopamine receptors so that you get that desire and that pleasure feeling. And the company is really cool because they're giving you the first month free. So I think it might be worth a try. Anyway, I'd love to meet you. And I have, if you're not familiar with my practice, I have a female urology, urogynecology practice, and I do tons of surgery. I love surgery, but I also love non-invasive options, and I have all kinds of options in my office. So check us out. You can see me on my website, christimd.com. If you like this video, give me a thumbs up. Love comments and questions, and hope to see you soon. Bye-bye.